Good afternoon, everybody. Sentara Susan, and I am on a field trip today so that I can bring you Dr. Denis Halmi.
Hello, hello.
Everybody, do you guys know him? He is one of our highly skilled, highly trained, board-certified weight loss surgeons. He's also the director of the Sentara Weight Loss Surgery Center, and we are talking a little bit about weight loss surgery. First off, we have a free seminar coming up on Saturday, just 2 days away. If you've ever had any questions, wondered if weight loss surgery is right for you, this is the event for you. It's going to go on Saturday, March 9th at the Homewood Suites right here in Woodbridge from 10:30 until 11:30. Did I mention it's free? You're going to get a chance to talk to Dr. Halmi. You're going to get a chance to ask your questions. You're also going to get to learn more about this procedure because as it says in the title, it is a surgery. So certainly something that you want to weigh your options. Let's talk a little bit with Dr. Halmi. Dr. Halmi, what exactly is weight loss surgery?
Hello, hello. Well, I will tell you a little bit about weight loss surgery, but first I want to tell you that if you're struggling and trying to lose weight, and if you really tried it, and if you need to lose more than 50, 60 pounds of weight, you have to take it very seriously because that amount of weight puts you at high risk for lots of medical problems. So you need to be very serious because this weight impacts your health. You have several options. Obviously, losing weight is difficult. There are lots of different diets, medications. If you have tried those, if you are frustrated, if you couldn't lose them, you need to consider surgical weight loss. Surgical weight loss is very, very successful, but it requires a lot of lifestyle changes. So you have to take it seriously, you have to be committed, but it does work.
Wonderful. You mentioned a lot of different health ailments. What kind of health ailments are we talking about? I know, for instance, we were talking with one woman. She had been on an insulin pump. She is no longer managing her diabetes that way. She is out. She is not taking any insulin now, and it's just because she's lost a severe amount of weight.
I mean, diabetes is very, very common. The type 2 diabetes with increasing weight, the risk of diabetes is high. High blood pressure, sleep apnea, acid reflux, and there is a lot of many different medical problems that are associated with the weight. So by reducing the weight, you can reverse those. And we see this all the time, that patients who come in to see us initially, they have a long list of medications that they take on a daily basis. Once they have weight loss surgery, a few months later, the medication list gets shorter, and hopefully at one point the medication list will be down to nothing.
That's exciting. It's exciting, especially when you really understand that this is giving people a new lease on life because that excess weight, it's taxing your heart, the high blood pressure, as Dr. Halmi said, the sleep apnea, diabetes. I mean, the list goes on. So anybody who's had more than 60 pounds on them has maybe some medical complications, ideal for this.
Ideally, weight loss surgery should be considered for someone who needs to lose 60 or more pounds of weight. Now, most of the time, if you have that much excess weight, there is always some medical problem, joint problems. That's why the surgery is called metabolic and bariatric surgery, because we know that the surgery is not just for reducing the number of pounds. So it's not really just weight loss. The surgery is to reverse or fix the metabolic problems that are associated with the surgery. With the obesity. And therefore, once you're successful, you lose the weight, your entire life will change. Your quality of life improves, your health improves, and actually studies show that the length of life, the longevity will improve. So you're saving a lot of good years for you for the future.
And I think that's what's so special about these upcoming seminars, because they're free events where if you've ever had that question in your mind, is weight loss surgery right for me? These seminars are there to answer your questions. And it's almost like you're having your free initial consultation with Dr. Halmi, because you're going to get to ask him the questions that have been laying on your mind, that have been weighing on you. And that's very special, I think.
The seminars are very good because it's a very informal environment. We talk, we ask questions, I will ask questions, you will ask questions. So we exchange a lot of information on an informal setting. So you can explore the pros, the cons. I can tell you some specific experiences I had with patients. So I think it's a kind of a fun meeting where a lot of information gets exchanged, and if you're considering surgery, or if you even just thinking about looking into it, that might be one of the first things that you want to do.
Wonderful, because there are many different types of surgeries out there, and you want to find one that is tailor-made for you and your condition and how much weight you're carrying and that sorts of things.
So we will go over the different types of procedures. I can show you some pictures, some videos, and others. About each surgery, we talk about the risks, the complications, and then we can kind of figure out that who should be a good candidate and which procedure is the best. But again, the bottom line is that, you know, if you're struggling with weight, you need to take it seriously, and there are options, and you need to look into all your options, and one of them is surgical weight loss.
Wonderful. And as we wrap up here, I was just sharing with Dr. Halmi, I had talked to one of Dr. Rizvani's patients who said, you know, I used to feel like I'd take a step forward and then I'd take 2 steps back. I always felt like I had this black rain cloud hanging over my head. She wound up having this surgery. She wound up getting off her insulin. She wound up not needing the pump to manage her diabetes. She wound up getting a new job. She feels like she has an entirely new lease on life. She is just overjoyed, and she sings the praises of Dr. Rizvani, Dr. Halmi. So it's pretty exciting stuff.
So again, I mean, we see this all the time, and you know, I'm lucky to have a very good, skilled, dedicated team of professionals. My associate, Dr. Rizvani, we have nutritionists, psychologists, exercise specialists, in addition to the medical, the nursing, and coordinators. So again, if you come to our seminars, I can introduce you to some of our members, some of the members of our team, and you can ask questions about all the details.
That's wonderful. All right, I'm going to show you real quickly online. I'm going to post the link, but I wanted to show you just in case you wanted to go to our website. This is a little discerning for people because it is a mirror image from when I'm showing you, just as if you're showing a picture or something like that, or you're taking a selfie. So we have a page here on our Sentara.com website. If you go down to classes and events, click on that. It's at the very bottom of your page. Confirming we're in Woodbridge. Yes, sir. And then right here, first thing, bariatric and surgical weight loss seminar happening on Saturday, 10:30 to 11:30, Homewood Suites. We only ask that you register so that we can have your information. Very easy to fill out, nothing too wild and exciting there, and you just say confirm for details. I'm going to put that link up on the top of this Facebook Live so that you can just do it there. You don't have to worry about navigating the website. But if you have a few minutes, you might want to go to the website because there's a lot of great information there. All right, so one more time, just in case you didn't get it the other times I said it. So Saturday, March 9th, so 2 days from now, 10:30 to 11:30 in the morning at Homewood Suites. You get to have a chance to talk to Dr. Halmi. You're going to get to learn more about weight loss surgery, what procedure might be right for you, given your medical history, given your current weight, in your weight loss goals, given your different medical conditions that you might be living with and carrying. So it's a very informative session. It's a very conversational session, and I think you'll really enjoy the team. So everybody, we look forward to seeing you on Saturday. In the meantime, please be safe out there, and we will talk soon. Bye-bye, everybody.